Greetings. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Pandemic Task Force, and this will be our final pandemic report. The task force is being disbanded, and as long as things don't get too much worse, hopefully this is the last pandemic report I'll be delivering to you. Okay, so I want to remind you that the objectives of the task force are and were to address your concerns and questions about COVID-19, as well as enabling evidence-based decision-making on behalf of our local leaders. There are several interventions that are taking place to control the spread of COVID-19. The number one is getting vaccinated. So if you haven't gotten vaccinated yet, make sure you get out there and do so. If you do become ill, you're still encouraged to isolate if you're symptomatic. And if you haven't been vaccinated, get vaccinated. And also, if you haven't been vaccinated, you still need to wear your face coverings and social distance when you're inside in enclosed areas or in crowded areas, whether they're inside or outside, and you're encouraged to avoid crowds. Okay, so we're at about 43,500 total cases of COVID-19 in the Coastal Bend. Those are confirmed. There's obviously been many more. Confirmed cases are ones that were identified or validated with a PCR test or the nose swab test. And there have been 41,800 recoveries. The thing that I really pay attention to is this active cases, and we've had another week-over-week decrease of 8% in the active cases, down to 410 confirmed active cases, so moving in the right direction. The transmission rate is slightly higher this week than we estimated last week at about 0.8. But when the transmission rate is below 1, that means COVID is in recession. You can see in this graph through time where we've been all the way up to about a 3.3 a year ago, or a little less than a year ago in mid-June 2020, followed by a drop. And then this is our fall and winter peaks here. And since that time, we've been just around 1 or below. So that's what's gotten us to this point now where COVID is becoming less and less common, although it is still out there in our community. In terms of the number of new cases per day, each dot on this graph represents the number of new cases that we see in the Coastal Bend each day. You can see right now it's very low, much lower than we've seen either last summer or over the winter. And the projection is indicating that we're going to have a continued decline. The projection is based upon a fit of the model to the data, and we just continue this same trend, assuming that the transmission dynamics will continue along the same course that they're on now. When we break down the number of new cases by age group, and we can only do this for Nueces County, but it's probably representative of a broader area, we can see that most age groups are down. 0 to 17-year-olds down, 18 to 39-year-olds down in terms of numbers of cases. The 40 to 64-year-olds, you might interpret this as a slight upwards trend, but it's probably more of a flat line right now. 65 to 79-year-olds slightly down, and 80 plus slightly up over the past month. Looking county by county, you can see overall Nueces, a precipitous decline in the number of new cases per day over the past month. Getting down into some other counties in the Coastal Bend, San Patricio, Duval, and Brooks, they're up over the last week or two in terms of new cases. We're going to zoom in on the other Coastal Bend counties so you can see again, San Patricio, Duval, and Brooks are up. Refugio is up and then kind of level over the past week. Aransas has been trending upwards, but again, if you look at the axis, very low, less than 1 new case per day in Aransas, with up to about 3 to 4 new cases per day in Duval, Brooks, and San Patricio. Zooming out to the South Texas metro, or the South Texas metros, you can see that there's a mixed signal. A lot of places are down overall, but there is Laredo, which has jumped up over the past week, and this isn't a huge jump compared to where we've been, but it's something to watch in the future. Victoria was something that we're watching. It looks like it's peaked and is on its way down, so that's a good sign. But it's also a reminder that this happened just very recently, and we've been watching Victoria closely because it was going up over the past couple weeks. And it's an indicator that there's still the possibility to have at least a small surge with between 45 and 50% of the community having no immunity or antibodies to COVID-19. It's still possible for there to be a fairly decent surge in COVID. Okay, going to the whole Texas area, these are the public, the hospital regions, and for each of them, you can see that overall they're mostly down, or even the one exception is South Texas, which is just ever so slightly up, but overall pretty low and pretty consistently low, but not at zero. And I think that's the important thing to remember. COVID's still out there. And this would be a good time to remind you that in your decision to get vaccinated or not, realize that COVID's pretty much not going away at this point. And so if you think that, well, other people have gotten vaccinated, so I'm not going to, realize that there's a very high probability that you will eventually contract COVID, because it seems like we're not really going to be able to remove it from the population at this point. So it might be 2 years from now, but if you hadn't been exposed, you're still going to be just as susceptible to the negative effects of COVID as you are now or as you were last year. So that's why we're encouraging people to get vaccinated, because you have almost no chance of severe negative health outcomes if you're vaccinated against COVID. Okay, looking at the hospitalizations, the number of inpatients with COVID is trending downwards. And if you look at where we've been, we haven't been this low since June of 2020. And so that is a good sign, and the projection has us continuing in that direction downwards. Hopefully that does continue. We're going to break this down into the different sections of the hospital. Med-surg beds is general admission. And you can see that there was a slight uptick in general admissions over the past week, but it's back down on our projection line. You do see that there can be variation up and down through time, so I don't see this as a major departure from the projection. And for the ICU, we have the same general sort of pattern where it's coming back down to the projection, but with a little bit of variation and some up and down there. Okay, looking at the ICUs the way that we normally do in our light blue and red graph, where these are the number of patients in the ICU on May 25th. There were 16 patients with COVID, 146 without COVID, and 162 total. This dashed line represents the average number of people in the ICU before COVID really took off in 2020. And so what this means is that if you need ICU treatment, you can get it right now. COVID is not stopping you from getting the level of care that you need. These are the same figures as that last figure, but for the whole state of Texas. I'll point out once again, Victoria, you can see that they've had a spike a lot lower than in the winter or winter of 2020/2021 or the summer of 2020, but nonetheless a marked increase in the number of COVID patients in their ICU compared to most of the other counties and us right here. And this is just like the last graph, but on one day where everything's scaled to 100%. And the more blue you see, the less strain there is on the ICU from COVID. The more red you see, the more strain there is on the ICU from COVID. So in Victoria, there's a fair amount of strain on the ICU right now from COVID. And in the Lufkin area, there's also been a little bit of an increase since last week. That's fairly appreciable. It's about 25% of all the patients in the ICU have COVID there. Moving on to fatalities, this continues to trend downwards. This is the weekly fatalities. I don't show this very often, But this is what we're using to check and make sure the projection is calibrated well, because there's less variation than in the daily cases. So each one of these dots represents the previous 7 days worth of fatalities. You can't sum these up, but it does make a more smooth line. You can see the projection is following that pretty well. I expect that what we'll see here in the future is this is going to drop down, and then it's going to come up again, and it's going to drop down, and it's going to come up again, just the way that it has, probably following that projection, unless there's a major change in the amount of people contracting COVID in the coastal bend. This is the graph for every day, how many fatalities are there per day. These can be summed up to the total number of fatalities for what it's worth. And you can see why I like the previous graph, because there's a little less variation in it. You can see that we're trending downwards in terms of the new fatalities per day, and we're below 1 fatality per day on average in the coastal bend. Overall, we're at 1,292 fatalities from COVID across the whole coastal bend. I want to remind you that it takes about 14 days to fully process the death certificates at the state level where the statistic comes from, and only if the primary cause of death is COVID-19 does somebody get counted here in this statistic, and we're at 819 in Nueces. And I looked back at our first presentation, and we had made a projection of how many fatalities there could be if nothing had been done versus what we did do. And I decided to bring this back one more time based upon everything that I can glean right now. Because of all the things that we've done in the coastal bend to stop the spread and transmission of COVID, we've probably avoided at least 2,600 fatalities over the course of the pandemic from March of 2020 to present. So it could have been more, but I'm sorry, there could have been more fatalities averted, but there also could have been less. And overall, we didn't do that poorly in terms of mitigating the negative effects of the pandemic in the local area. Moving on to vaccinations. The percentage of the population that's fully vaccinated in the coastal bend counties ranges from about 23% in Live Oak to 40% in Aransas, with the other counties coming somewhere in between those numbers, averaging out around 34%. And you can see here, this is every trauma service area in Texas. So this is all of the state of Texas, and we're at 34% of the population being fully vaccinated here in the coastal bend. You can see that some places like Laredo are up to almost 45% at this point. Maybe that's 43, 44%. But it does show us that there's room for improvement here in the coastal bend, and certainly more of us can get vaccinated. Looking at the trend, I think it's very clear at this point that the number of fully vaccinated people is slowing down. You can see that I've plotted this straight line if we had just a linear increase in the number of people getting vaccinated from February through present. And what you can see now is this strong departure from that original trend. So this indicates that we're slowing down. This is increasing at about 1% per week right now. If you want to make projections on your own out into the future, right now the number of fully vaccinated people is increasing at about 1% per week, but realize that as we move forward, that's slowing down. And we're probably not going to extend this out at the same level and reach 100. It'll probably stop before then. Moving down to the age breakdown of the people who have been fully vaccinated in the coastal bend. And I want to remind everybody that these age categories are determined by the state of Texas. This is the way that we get the data. I'm not able to break the 16 to 49-year-old age group down any further than that. But you can see that overall, number of people fully vaccinated continues to increase across the age groups. You don't see the 12 to 15-year-olds yet because there hasn't been enough time for them to register as fully vaccinated, which would be 2 weeks after their second dose. All right, let's look at the proportion of the population with at least one dose. And again, this is out of the whole population, not just adults, not just people that are eligible to be vaccinated, because herd immunity is blind to who's eligible to be vaccinated and who's not. It's about what proportion of the population has been vaccinated. We're at 41% approximately in the coastal bend. You can see that right there. And the trend, again, is no longer linear. It's obviously leveled off here, and we're on a new trend of about, again, 1% per week increase in the number of people with at least one vaccination. Breaking it down by age group, you can see that there's fairly linear increases across the age group, with the 12 to 15-year-olds jumping upwards. They do register in this at least one vaccine dose category. And I want to remind everybody that people below the age of 12 won't be eligible for the vaccine most likely until September. Okay, so in summary, the new cases have declined and are declining. Hospitalizations and fatalities are also declining, so this is a good outlook for us right now. I want to remind everybody that Victoria in the state of Texas stands out as a COVID hotspot. It did peak and it does look like it's starting to decline. Hopefully that continues. But realize that 33% of the patients in the ICU there, approximately, maybe a little bit more, are COVID positive, and there is a fair bit of strain there. I want to encourage everybody to stay vigilant, despite the fact that the task force is ending on June 1st. You're still encouraged to get vaccinated if you can. If you're not vaccinated, you're encouraged to wear face coverings. The doubling up still works if you only have cotton masks or surgical, and social distance. And I want to leave you with my primary concern right now. And during our Q&A session, I said that I wasn't really going to go back to normal in terms of holiday celebrations, given that we're coming into Memorial Day weekend. I'm not going to go back to a normal holiday celebration this weekend, and I'm going to wait till July 4th, because last year, when the rest of the country was going into a COVID recession and a kind of sunny days when it comes to COVID, we here in the coastal bend were going into what seemed to be prime COVID season, and our transmission rate skyrocketed in the month of June. That happened here. It happened in the lower Rio Grande Valley. And if you look at a map of Texas, as you went farther and farther south, and farther towards the coast, the summer spike last year got bigger. As you went inland, it got smaller. So we're a little bit different than most of the country and most of Texas. And so this is my primary concern moving forward, is what's going to happen when the season changes, and presumably the transmission rate of COVID will change without us changing anything, and it's likely going to increase. So I encourage everybody to stay vigilant. Okay, with this being our last presentation, I want to thank a number of people. First of all, the task force founders, overseers, leaders. That includes the Kelly Miller, Barbara Canales, Peter Zanoni, Ahmed Mahdi, Frank Pezzold, Annette Rodriguez, and Philippe Tissot. Thank you for your leadership. The government coordinators that were involved with the task force: Karen Costanzo, Dan McGinn, Hillary Watt, Denzel Odo Kunran, Dante Gonzalez, Josh Cronley, Holly Houghton, Steve Vieira. And this is a good time to point out that there's so many people, it's hard to remember everybody. There's so many more than this that that put effort into the task force. So I apologize if you're left out, but your contributions are much appreciated. We had a lot of people providing medical and hospital expertise. I know that I learned a lot about how how healthcare works in the coastal bend, and that enabled me to convey important messages to you. J.S. Walker, Mike Simmons, Mike Mohat, Emily Prote, Mike Deppert, Matt Newhauser, Mauricio Camargo, Mike McCutcheon, the Nueces County Medical Society, Krista Spahn, HCA, and Driscoll all were participants and contributed to our understanding of the way that hospitals deal with COVID. Media relations from both TAMU-CC and the City of Corpus Christi, Daryl Pear, Louisa Butler, Tiffany Anderson, Jason Lewis, Dominique Damian, and overall the City of Corpus Christi Communications Department were invaluable. We were presenting every week, sometimes multiple times per week at City Hall. And after we went to social media, they continued to work with us to link our presentation. So thank you to you. The administrative support that really helped the task force run: Gina Concanon, Deanna Kreitz, Luis Hernandez, Lisa Garza, Rebecca Ballard. All of you were critical, and thank you so much for helping us. And I want to put a particular spotlight on the modelers and data processors because they were the ones throughout this whole thing really putting in a lot of work every week of this of the task force. These are the people that made the figures and made sure the data worked, and we were able to bring you the latest information. Jason Selwyn, Brian Gillis, Davey Edwards, Evan Krell, Mahmoud Eldfroy, Lucy Huang, Roy Roberts, Cody Myers, and Jason Louis. And lastly, I want to thank people who are tuning in to our internal task force meetings every week for the past year and 2 months: Lucy Huang, Meng Zhao, Greg Buck, Scott King, and Leisha Martin. Thank you to all you and everybody else who's contributed to the task force, as well as everybody out there in the greater Coastal Bend community that provided feedback and helped us improve the product that we were able to deliver. With that, I hope everybody has a safe and enjoyable Memorial Day weekend, and let's hope that